I would like to offer my personal message to our friends and supporters out there and those that we support. We would like to wish you all the very best and hope that you are staying safe during these challenging times. Whilst Covid-19 is already at the forefront of our public health professionals' attention, fetal alcohol spectrum disorder remains an important issue and presents its own unique challenges. This crisis is especially difficult for children and adults with FASD because they can have a high rate of pre-existing health conditions, low levels of health literacy, and they rely on others to access the care. Social distancing has necessitated the separation of people from their support providers, and many crucial support services have closed completely during this crisis. FASD awareness's number one priority are our service users, and as we are unable to provide our usual physical support, we are implementing ways to provide support virtually so that our families do not feel any more isolated at a time where they are already feeling lonely, isolated and worried. The coronavirus pandemic is exacerbating an already difficult time for our families, and we recognise that the effects are likely to be long-term. We will be reaching out to all our service users to ascertain their needs and provide various solutions to reduce isolation. This will be a completely new project created as a direct result of the pandemic and includes online support groups, regular contact by buddying and access to trained mentors. We will also be actively undertaking a social media campaign to highlight the effects of drinking alcohol whilst pregnant. In times of crisis and psychological distress, the rate of harmful alcohol consumption increases, as can the birth rate after periods of social isolation. Together, extended seclusion and stress could mean more pregnancies exposed to more harmful alcohol consumption patterns. And so I leave you with a huge thanks to the funding that we have received from the National Lottery funding, the government, through the Coronavirus Community Support Fund that has enabled us to continue this work and help our community through this pandemic. We thank you so much.